This is a 20-ish-year-old patient who came into the ER for chest pain that traveled to the neck. And this ultrasound was done. First, you have a view of the heart. This is a little oblique peristernal long. And with this view, you have a peristernal short. And with these two views, I think you have enough to say that there's a good ejection fraction, there's no pericardial effusion, and there's no RV strain. So, relatively unremarkable point of care bedside ultrasound of the heart. The patient also complained of neck pain, so the carotids were evaluated. This is one carotid in long axis. You don't see any dissection flap. There were more clips saved, but I thought this was a good representation of one of the carotid arteries. Now, on the other side of the neck, the carotid was difficult to visualize, and that's because you see what appears to be air in the soft tissue muscles of the neck. It looks like A lines that exist here, and you really are having trouble viewing the carotid artery. This is the provider trying to press to push this air out of the way. And despite that, you really are having difficulty looking at the carotid artery. And in someone who's in his 20s, that shouldn't happen. And so when you see this finding in the neck in someone who has chest pain that travels to the neck, you worry that this is mediastinal air that's traveled up into the neck. And that is indeed what happened with this case here. So again, to compare the two sides, this is the normal side where you could see the carotid nice and clear. And you can see how different that is to the contralateral side where you're having a lot of trouble looking at the carotid artery because of the air that's in the muscles of the neck.